ถานการณ์ไวรัสอีโบลากำลังเป็นสิ่งที่คนไทยหลายคนให้การติดตามและเฝ้าระวังอย่างใกล้ชิดนะคะและเพื่อให้ผู้ชมไทยรัฐทีวีได้เข้าใจกับเชื้อไวรัสตัวนี้มากยิ่งขึ้นวันนี้ไทยรัฐนิวโชว์อยู่กับดร.โยนาส เฮเกนผู้แทนองค์การอนามัยโลกประจำประเทศไทยค่ะสวัสดีค่ะ
สวัสดีครับ
Thank you for being here, Doctor.
Thank you.
So first of all, I would like to ask about the Ebola virus situation. Why does it seem getting worse every day?
There are a number of factors which contribute to its getting worse. One of the cases is that the health system in the countries affected is still not well developed. So patients still transmit the disease because the health workers are not covering as much as we would like them to do because the health system is not good. But also there are, it's transmitted through direct contact. So when a patient is recognized, some of them don't come to the health facilities, so they transmit among the family members. The burial tradition also gives family members more vulnerable because they have to handle the bodies, but they are not aware of what precautions they have to do, or they don't have the necessary protective clothing when they handle patients or when they handle dead bodies. So that's one of the reasons this is happening. As I said, the health facilities and the health system in the affected West African countries is challenged by the magnitude of the issue. The resources are not there, so all efforts has to be there to support them internationally through human resources as well as financially.
Is that true that Ebola can transmit with another people by sweat, by breath, and by tear?
Ebola is a very fragile virus. So yes, it can be transmitted through body fluids. That could be blood, that could be other saliva, and still more evidence is being built on the possibility of being transmitted through tear or other body fluids. Definitely it doesn't transmit through air or just by droplets as we know. Maybe if you look at it, if you compare it, it's transmitted the same way hepatitis or HIV is transmitted. So the likelihood of casual contact with a person is
Okay, what about Thailand? Do you think Ebola has chance to spread in Thailand?
There are two aspects which has to come together for Ebola to be a problem or to be transmitted in Thailand. First is the virus has to come to Thailand, and as you know, the number of flights coming from this country, so the West African countries, is not that big. So that's one reason. And people who are capable of transmitting the disease are visibly sick. So they are either having fever or other symptoms. And the Ministry of Health and the Thai government and the immigration and airport authorities have a good screening system in all port of entries, whether it is land port of entry or in the major airports. So by screening for fever, cough and so forth, you can get people and observe them accordingly. And you very well know a few cases has been under observation, and that's the transmission. The cases has not been suspected case has not been identified yet.
And good system that you said is good enough for international.
It is good enough. Actually, it is even exemplary for other countries. But additionally, Thailand, as I said, that was one factor. The second factor is you have a very good tradition of hospital infection preventions. The health professionals are well trained. There are infectious control nurses. You have a lot of developments and trained personnel available either to detect it, to prevent it, and to respond to it. So even if it comes, the likelihood of it affecting the general population is minimal. Yes.
Do you have any advice for Thailand about the solution to deal with Ebola disease?
The first thing is not to panic, and the media could help us a lot in creating a good awareness among the population. The second is already the Thai government has a committee looking into that. The Ministry of Health is meeting every day and trying to assess how surveillance or searching for cases is going on, how your personnel are well trained. All this is being coordinated. Thailand has already the protective clothing for health professionals bought and deployed into the appropriate places. So you have the laboratory capacity to confirm if a case arrives. So you have all the things ready there. And what I can say is let's continue being vigilant and strengthening these available resources.
Okay, last question, sir. Should Thai people worry here?
I think the Thai people should not worry. I think there is enough system in place to detect, to prevent, and to manage this disease.
Okay, thank you for your information,
You are welcome,
doctor.
and thank you very
สวัสดีค่ะ
much. สวัสดีครับ ครับคุณครับ
ขอบคุณค่ะ